Hi, I'm Meshal Malik and you're watching Indus Special. The rise in income inequality has for many years been seen to be one of the biggest challenges facing sustainable development. However, the conversation regarding the billionaires who own more wealth than the rest of the world combined and those who continue to lose has grown to become even more loud and important, given the coronavirus outbreak. On today's show, we talk about these global conversations as they unfold. Joining us for this discussion is Mr. Richard Wilkinson, who is a professor at the University of Nottingham Medical School and honorary professor at the University College of London. Also the author of The Impact of Inequality, How to Make Sick Societies Healthier. He joins us from New York. Also joining us today is Mr. Mustafa Talpur, who is an OXFM representative, joining us from Islamabad. He is working as a Asia regional lead on the Inequality campaign with OXFam. Thank you both for joining us and welcome to the show. Mr. Mustafa Talpur, I'd like to begin with you. Now, OXFam monitors the number of billionaires, how they increase by year, and the concentration of wealth. Now, before we get to how all of this is impacting the pandemic as we see it right now, let's just move back a little and discuss this and set the premise for the discussion to follow. How do you see these trends changing year by year, and what's really alarming?
Yeah, I mean, we have been looking into the economic inequality since the last 5 years, and every year you will see a surprising number coming up. So early this year in January, looking into the data that's produced by Credit Suisse Bank, there were only 2,153 rich people, what we call billionaires,
right,
who have more wealth than 4.6 billion people on the earth. This number, if you see, is astonishing, and every year these people are getting fewer and fewer, while the resources that going them to is more than that. And we also calculated that the richest 1% have more the wealth than the 6.9 billion people on the earth. So this is the pre-COVID-19 situation in which we were living. And we believe this is the policies that were started in early 1980s. With a new economic philosophy called New Liberal Economic Models,
right,
that actually taken a wealth from rich countries and rich people to a high wealth concentration in world's rich countries, but also a richer people in the poor countries like Pakistan.
Right. Stay with me on that point, Talpur. Now, you've stated out these figures. You've also mentioned that essential fact that the richest 1% now have more wealth than the rest of the world combined. You've told us how that concentration of wealth keeps on increasing. That's the question I want to take to Mr. Richard Wilkinson next. Now, it's very difficult to understand all of this, especially when we juxtapose it to the information that's given from the World Bank. Now, Mr. Talpur created this timeline in which he says that this has been increasing, income inequality has been increasing since the 1980s. The World Bank states that since the 1980s, we've been seeing a reduction in extreme poverty. Now, when we put those two trends together, does it really matter if wealth concentration keeps on increasing?
Yes, one of the things people have really misunderstood is how important relative income is. Not just your absolute standard of living, but how you compare with other people. The sense of anxiety, of failure, of being devalued, looked down on when your income is lower than others. The income differences are extremely important. And our research on the high-income countries shows that the bigger the income gaps between rich and poor, the worse the life expectancy, the more the violence, the less well kids do at school, the lower levels of child well-being. A whole raft of health and social problems get worse if the income differences between members of the population are bigger. It's really a very fundamental form of social damage, if you like, that holds countries backward.
Right. Mr. Wilkinson, now you mentioned all these factors, these disparities that continue to widen when there is a greater income inequality. I'd like to focus a little more and specifically on the healthcare sector. How does income inequality impact and adversely impact the healthcare sector?
Well, it's not simply that the differences in people's health get bigger, it's the average health that gets worse, the average life expectancy, the average levels of homicide or other measures of violence, the average maths and literacy scores of school children. All these things get worse if a country has bigger income differences between rich and poor. We now understand some of the reasons quite well. It's not primarily things to do with medical care, medical provisions. It's how the stresses of life affect your health and in many ways speed up the aging process, making people more vulnerable to a whole range of diseases, damaging the cardiovascular system, the immune system, and so on. It seems to be that chronic stress consequent on concern for status anxiety, things like that, feeling looked down on, is really quite important. It's our worries about how others see and judge us. You know, if we live in societies where some people seem hugely important and others are looked down on almost as worthless, we all worry more about how we are seen and judged, more concerned with our appearance and status and whether we seem to be clever or stupid. It leads to more anxieties about self-worth, if you like.
Right.
And that leads to more mental illness.
Mr. Wilkinson, that's of course, as you're saying, that's the only way out of it, that we move towards greater sustainable policies and sustainable development and trying to rectify the system we have at hand. But do you think these policies will resonate with the people who are in power right now? Will we see a major political shift that allows this to happen?
Well, one of the extraordinary things we've seen in many countries, including Britain, is governments. In Britain, we have a conservative government, which was regarded as fairly far on the right. It has, with the institution of this lockdown, we're all supposed to be confined to our homes and only going out for necessities. But people who've lost their jobs as a result of that, the government has promised to pay 80% of their incomes. There are systems for providing food parcels to the aged and very vulnerable. But there's also been a sort of outbreak of sociability, communities identifying and looking after the older people. So there have been extraordinary and unexpected changes as a result of this crisis.
Right.
So our government's policies, despite coming from a government that was regarded as far right, now look quite socialist.
Right.
And I think that makes it hard to predict where they will go as we come out of this crisis. I think there'll be a lot of pressure to maintain levels of government support and to tackle climate change more seriously than it has been in the past.
Right. Mr. Wilkinson, is an optimistic undertone that you take with your analysis there, and it's an important one during this time especially, that we try to somehow talk about what social transformations we will see coming out of this crisis situation. But just moving back a little, I want to talk to Mr. Mustafa Talpur, who's about how historically and how in the past decades at least we've seen power and privilege play a role in creating this income inequality, increasing it continuously and disadvantaging the majority just for the sake of a handful of people.
The policies that I was talking earlier, the economic model that was introduced and sold out to all the developing countries, heavily relied on the market intervention And we have seen all around the world in the last 30, 40 years, the governments have been really size of the government and the government intervention and the policy options left with governments have been reduced on the assumption that market has the solutions of everything from public services to providing the businesses and accommodating the labor market. But again and again, people have thought that this uncontrolled and unregulated market have a tendency, and this came clear in the Piketty's book as well, The Capital in 21st Century, that if the capital and market is unregulated, it's going to have a concentration of wealth and income, and that's what happens. Because people create monopolies, the companies who control the business or supply chain all around the world have the incentive to pay more to their shareholders. So it became really a crony capitalism, not taking care of the climate of the poor people, but just sucking the resources upward. That's how the people become billionaires. But the one instrument that was used to create a high level of inequality is evading the taxes.
Right.
Now, this is no hidden fact that there are offshore companies in small islands where you have billions of dollars kept there, even trillions of dollars, where the rich people and companies don't pay the taxes. So denying the due share of the revenue in developing countries really is a problem of today's fiscal issue. So countries like Pakistan, Sri Lanka, Nepal, you see all other developing countries in South Asia really having a huge problem because the rich people and the companies don't pay their due share in the taxes, and the governments have to have a heavily borrow. So we just calculated that Pakistan has to pay this year over $14 billion in a debt payment, a country that is struggling to provide a life-saving support to the poor people, a protective equipment to their frontline health workers, and a food to the over 70, 60 million people who are poor. They are struggling to that, and it's immoral to ask that country to pay a $14 billion debt payment.
Right.
So these historical policies that have really preyed on the poor and have created the wide gap. But just last point I want to mention that in this whole crisis, the women who are majority providing the care services, mainly on the unpaid and lower paid work, they are the hardest hit because they are the first who lost the job. They provide the care services in the hospitals and very low paid. They are not protected very well. So not taking into consideration the vulnerabilities of the unpaid and lower paid women's work is also an injustice. And that has also created this historical inequality.
Right. Mr. Talpur, I'm very glad you bring up the point of this gender dimension when we're talking about inequality. And that's something we're going to talk about more later in the show. Thank you so much for bringing that up and giving us greater insight as to what OXFM has reported so far. Thank you for joining us, Mr. Mustafa Talpur from Islamabad. Mr. Richard Wilkinson, talking a little more about the pandemic preparedness of various countries and the response given by various societies. Do you see a distinct difference in countries that have less disparities in how they're handling the situation, and those like the United States or the United Kingdom, in which there is a greater income disparity, how they're handling the situation?
It's too early to say definitively, but it's beginning to look as if more equal countries are handling this COVID emergency better than the more unequal ones. In the high-income countries, the more unequal ones are, as you say, countries like Britain, my country, and the United States. The more equal ones, like the Scandinavian countries, seem to be doing better, controlling it better.
What would you say is one of the main reasons why you think that their response is better in this regard?
Simply looking at the trend in death rates. That's the evidence. I'm less sure of how they have achieved that better trajectory. and stopped the disease being quite so devastating.
Right.
It may be to do with government policies. It may even be contributing factor may even be the ways in which inequality affects the health of the population in general.
Right.
I think the combination of the two. It's interesting that the countries that have done best, a number of them seem to have women presidents or prime ministers. And I think they've taken action earlier. Places like Germany and New Zealand, Iceland, all led by women, have done particularly well.
Yeah, that is something we're seeing put forth a lot on social media. The similarity of all the countries that have been responding better is that they have females in position of leadership. That's an interesting point you put there. I'd also like to welcome Mr. Steve Keen, who's a professor of economics at the Institute for Strategy, Resilience and Security at the University College of London and author of Debunking Economics. He joins us from Trang. Thank you so much, Mr. Keen, for joining us and welcome to the show. Now, you must have heard that last bit of conversation that I was having with Mr. Wilkinson. Do you agree that those might be some of the underlying factors as to why we're seeing certain countries respond better to this pandemic?
I think the comment about women leaders has got a certain amount of merit to it. There's a tendency for us to select narcissists. Certainly in the male leaders of the world, narcissism is a fairly common trait. The women, particularly Jacinda Ardern from New Zealand, do not seem to suffer from that, and they have themselves had to be twice as good as the men to get anywhere near as far. So that may be an issue. But it isn't just income inequality. One point to show that it is a question of policy as well is Sweden, which of course is a country which is renowned for a substantial level of social cohesion and social equality. It's followed more of the so-called herd immunity approach than its neighbours, and it's certainly doing much worse than them. So it does come into policy as well as, I think, thinking of a distribution reflecting a stronger commitment to a common vision of society. You certainly couldn't accuse the USA and the UK of having a common vision. They're riven by political conflict as much as they're riven by inequality.
Right. Mr. Keen, that was a very zany remark you made about the politicians, male politicians there, but one that definitely holds a lot of merit given the type of personalities we're seeing in power these days. Now, another debate that we're seeing plastered all across social media comes down to the billionaires and their donations, their philanthropy when it comes to this pandemic, how much they're donating and whether that's enough or not. I'm curious to know both of your takes on that. Mr. Steve Keen, I'd like to go to you first regarding that.
It is not necessary for the billionaires to give money for this. One of the great fallacies of the last 40 years of economic management is the argument the government has to borrow in order to spend or has to tax in order to spend. And neither of those are true. The governments can create all the money they need because they effectively have the money factory of the central bank, which can create money at will. And we're now seeing that being acknowledged by governments around the world, particularly the British government, which is now directly financing its treasury spending. So there was no need for austerity in the first place. And that's what has actually caused a large part of the failure of policy in countries like the UK. The austerity, allegedly saving for the future, was A, unnecessary. You don't need to put aside money when you can create it in the first place. And B, what it meant was what you actually needed was savings in ventilators and savings of masks, and dare I say it, savings of extra nurses and doctors as well. Those savings weren't there, and that's why the UK was initially so badly devastated.
Right. Mr. Richard Wilkinson, on that another point there, do you feel like, do you share the same view as Professor Keen, and do you feel like billionaires don't really need to donate in that way? I mean, we have a lot of historical factors which have led to their concentration of wealth. Their redistribution, whether it's through philanthropy or some other means, isn't that necessary during a time like this?
I think what has already been said about the power of governments, central banks and so on to create money is absolutely true. And I think our societies have been very slow to recognize that. But I do think all my work and research shows that having these big income differences in a society is extremely damaging. So I think it's important to stop tax avoidance,
right,
and to raise top tax rates. They're much lower than they have been historically. And I think in all sorts of ways, but starting with increased social cohesion, a more equal society is beneficial. The sums of money, I don't think that are needed to deal with the COVID epidemic is much bigger, I think, than would ever be raised by taxation from the very rich. You'd have to confiscate most of their property, I think.
Right. Systematic restructuring would be necessary, of course, in order to bring about this wealth redistribution. Mr. Steve, now when we're moving from the situation, what policies do you think governments across the world need to urgently take, as Mr. Wilkinson pointed out, for greater social cohesion?
Well, predominantly realizing that the government doesn't have to tax in order to spend. And the fact that the rich can evade the tax using income taxes has really meant the pressure of income taxes fallen on the middle and working classes, and they've ended up supporting parties which actually then end up removing the social services that have benefited the working class and the middle class in the meantime. So we need to be more clever about this than we've been. And the first step there is acknowledging the government's capacity to create money and then saying, well, if we can't tax it off the wealthy, how else can we create it? And I've proposed as a solution, not just to this crisis, but to the 2008 crisis, which was caused by excessive levels of private debt, having a modern debt jubilee where the government creates money and distributes it directly to everybody to effectively reduce the level of income inequality and reduce the level of debt at the same time, which itself has contributed to the level of inequality. So it's feasible to be more clever about this, but we have to understand how a monetary capitalist system works in the first place. And unfortunately, the main barrier there has been conventional economics, which has really championed the inequality as well as enabling it.
Right. Mr. Steve Keen, just one last question. Do you feel, earlier I talked to Mr. Wilkinson about this, and he had this optimistic overview of the fact that hopefully we will see a transformative change. But when you align that with the rise of the right wing all across the world, the way we're seeing this political wave unfold across the world, do you see that happening after this pandemic is over? Do you feel like we will see greater movements towards a transformation, a change in this economic system?
One of the problems is that the wealthy always can organise more easily than the poor, and that the wealthy have the ear of governments to begin with rather than the poor. So it's actually much easier for the wealthy to organise and try to re-establish what existed in the past. I think it simply isn't feasible for that to happen. So it's going to be the barriers coming from the sheer inability to go back to what used to be called business as usual that's more likely to lead to a transformative change in society. But I certainly would not underestimate the capacity for a right-wing, fascist even, flavour to come over society after this crisis. And certainly in the Indian subcontinent, I'm quite worried about how the developments could take a racist turn there as well. And that could be possibly the worst situation for the virus on the globe. So blue skies are possible ahead, but I'm actually more worried about dark ones.
Right. That is, of course, something that pointed out and is concerning and alarming to see that these flames will just get worse. The right-wing flames will get worse after this pandemic. Thank you so much, Mr. Steve Keen, for joining us, Mr. Richard Wilkinson for joining us from York. We're going to go for a short break. When we return, we're going to continue our discussion. Stay with us. Welcome back to the show. While we talk about income inequality and how it's going to be impacted, exacerbated after and due to COVID-19. Now joining us for this conversation is Mr. Ikemesit Effiong, who is the head of research at SBM Intelligence, an African-focused risk consultancy. He joins us from Nigeria. Also joining us today is Ms. Roshanay Zafar, who is a development activist in Pakistan working in the field of women's economic empowerment. She set up the first specialized microfinance organization organization in Pakistan, the Kashf Foundation. She joins us from Lahore. Thank you both for joining us and welcome to the show. Mr. Effiong, I'd like to continue with the conversation we were having previously, which revolved around how the world's richest, the billionaires of the world, are being urged to donate more and more. Given the income inequality and how these people have such a high concentration of the world's wealth, how essential is this redistribution at this point in time?
I think we have to first go back to the causal effect of the income inequity itself. And I think that's really the bottom line. Rather than saying that we redistribute it, I think it's really about how do we address it from the basis of wealth itself. So I think the first notion to ask ourselves is, where have we failed?
Right.
And there's several levels of that. I mean, if you look at what's happening in the world today, it's not just about the redistribution of health. It's about how priorities have been set across the world. As a student of economics, in policy making, the basic trade-off that you learn about is guns versus butter. And when we talk about butter, it's about welfare, investing in the welfare of people versus investing in military infrastructure. And that's really where the priority setting has been wrong. We've been ignoring climate change. We've been ignoring human development. We've been ignoring social change, all the investment that we need to do on, for example, healthcare infrastructure. So if we look at the world over, the question we really need to ask ourselves is not about the inequity of wealth. It's about setting the wrong priorities. It's about the incentivization that was given by the government to, let's say, the big businesses of the world. We've all been running after wealth creation, but we really never asked ourselves, what is the bottom line? As a human civilization, what is it that we need to leave behind as a legacy? And that's where we fail. So I think income equality is one issue, of course, and it affects different countries in different ways. If we look at emerging countries, of course, this is a major issue. We have the haves versus the have-nots. We have people where concentration of wealth, and that concentration of wealth is coming from a lot of times from contacts and connections rather than from actual productivity and development and income generation. So we really need to ask ourselves, what are our political systems delivering today? Are they delivering the welfare of human beings, or are they delivering wealth to those that already have more wealth? And that's really where the question comes, as I see it.
Right. Mr. Effiong, following from whatever Ms. Zafar has stated here, do you agree with her? And talking a little more about this philanthropy aspect, do you believe that it creates the smokescreen for preventing greater redistribution further on in the future, more systematic redistribution?
Yes, indeed. So what you would find out in developed economies like the United States is that a lot of high net worth individuals, a lot of billionaires have actually, through the agencies of lobbying and also through controlling the political process, being able to out-donate smaller donors, for example, they have been able to capture the political system and ensure that some of the more systematic efforts, at ensuring things like universal healthcare, for example, or providing education support so that newborn mothers are able to have access to kindergarten and other resources which might help them during the early stages of their children growing up. It has created a gap in the public discourse, which philanthropy over the last decade plus has been looking to contribute. You look at a situation like my country, for example, Nigeria, where we have Africa's richest billionaire whose companies have significant interest and essentially control the markets for things like sugar and flour and cement, which are essential commodities which in a pandemic-laden world we can't do without. And capturing the process and ensuring that efforts at systemic political and economic reform are not instituted has actually ensured that the world is now in a position where we have few other options than to rely on the goodwill and the philanthropy of these billionaires. And so, yes, it's a problem. And like your other guest said, it has gotten in the way of us demanding more of government. Government almost seems in many countries to be like an effort in funneling private resources towards goals which are largely determined by private interest and outcome. And that's a very unhealthy environment, and that's a very unhealthy position for the world to be in right now. And it is something that the COVID pandemic has, highlighted, I think, in very, very stark detail, the need for us to begin to have those conversations and begin to address.
Right. Having these conversations is, of course, very essential, but also targeted policies and coming up and implementation of that is even more necessary during this time. Mr. Effiong, I'm curious to know, given Nigeria's context with how it dealt with Ebola, do you feel like in terms of creating targeted policies which help to provide relief to the poorest and the most vulnerable of society, Nigeria somehow has an edge over other places in the world and especially in Africa?
Well, whatever edge Nigeria had, based on the experience we had in successfully containing Ebola, has actually been frittered away by the fact that Ebola was one, a fairly localized epidemic. Two, Ebola wasn't as contagious as COVID-19, and so for an Ebola patient, for example, if a person had Ebola, it was pretty clear because the person would start manifesting the symptoms. But the consensus of medical experts have now tell us that it is possible for you to transmit COVID-19 even when you're asymptomatic or you're not exhibiting symptoms. And so while Nigeria has a lot of experience and still does have a lot of expertise in things such as contact tracing, there is a dearth of test kits, for example, in the country. We do not manufacture ventilators. All of these things have to be brought into the country. Right now, Nigeria has tested a little over 5,000 people, and we have something on the order of 400 cases, right? So COVID-19 tests as a proportion. And as a proportion to the country's population, Nigeria is actually the lowest in Africa. We have countries like Ghana, Uganda, and South Africa that have outtested us. And so that advantage that came from having the experience with dealing with Ebola has been hampered by the systemic, economic, and structural issues that come with us not being able to manufacture the things that we actually need to be able to.
Right. Effiong, I take your point there. Since we're short on time, I want to talk about how different countries are dealing with this, and specifically talking about Pakistan. Ms. Roshanay, Zafar, now, when we talk about targeted policies specifically and for the most vulnerable, earlier on in the show, we discussed how COVID-19 will impact women the hardest. 70% of healthcare officials in the world are, of course, women. They will be disproportionately impacted by this. How do you think this relief can be provided to women in our region at this point in time?
Well, I think there has to be a step up. There will have to be a few approaches to do this. First is obviously the immediate relief. And when we are talking about targeted programs, we have to make sure that the people who deserve it get either, whether it's a cash payout or whether it's relief goods, those need to get to those people who really need that. And yes, as you said correctly, as you identified, there is a deep feminization of poverty in South Asia, where women are, out of every 4 individuals, women are the ones, three of those are women in terms of poverty levels. So the face of poverty in South Asia is definitely feminine. So if we look at that, the first issue is really about getting the relief to the right people. How do we do that? That's really a huge, humongous task when it comes to that. The second is rehabilitation. When we're really talking about the medium term, we're thinking of how do we go post-COVID. So we did a survey of women entrepreneurs across Pakistan, and one of the things that came across in that was that 90% of the female entrepreneurs that we fund through our program were actually facing economic difficulty. 90% of them said that their income had decreased, and over 60% said they only had enough liquidity to manage rations for 15 days. So, of course, the first aspect is really address the immediate needs, and then over the long run, how do you get them access to financing? How do you get them access to a capital where they can regenerate their businesses? Because that's going to be critical as well. So I think we'll have to do parallel sets of policies or parallel sets of programs to get the female entrepreneurs and low-income households where women are contributing. As you know, 80% of women in Pakistan currently contribute to incomes in low-income houses. So it's not the exception; it's actually the norm. So we need to make sure that those needs are addressed both in the short run and the long run through proper targeting, and in the long run through access to finance. And when we talk about financial services, we are not just talking about access to credit. We are talking about savings, because that becomes a very important strategy to addressing crises like COVID. And the third aspect is insurance. So access to insurance also becomes a major issue.
Right. Talking about all these long-term and short-term policies that need to be implemented, what do you feel like will be and are the main hindrances in trying to implement this right now? Do you feel like there is a lack of data for which we need to work on? What do you see is the main problem when we're trying to reach these vulnerable women?
One of the things is with the Benazir Income Support Program, you do have better data, you do have poverty scorecarding, you can piggyback on that. You can make sure, because this has happened, G2P, what we call government to people transfers, have been going on in Pakistan for a long time. So we really just need to leverage on that, and then we need to involve other stakeholders. So, for example, if you talk about the microfinance industry today, we reach over 10 million individuals, households. So using those networks will also help you target the low-income families faster. So I think it's about putting getting all the hands on deck and making sure that we all collaborate and we share the data that is available and that we're not running after the same individuals. That also becomes an issue when you are providing relief. So I think several of those elements will have to come into play. So it's not just the government that will have to deliver on this, but also other civil society entities and development organizations as well.
Right. On that point, thank you so much, Ms. Roshanay Zafar, for taking out the time and joining us. Mr. Effiong for joining us from Nigeria. Thank you for watching Indus Special. We will see you again tomorrow with more stories. Till then, goodbye and take care.